Okay, hello everybody. Good afternoon. It's an honor for me to be here today. Nea Dixit asked me to talk with you about a topic that is very important to me. It's about the new GBT machine and also sustainability with this new GBT machine. So first of all, I think it's better to introduce myself. So I'm Cristina Ruopolo. I'm a dental hygienist. I'm from Italy, so I'm an Italian dental hygienist. But I live here in Switzerland since 2016 in the French part. And I'm also an SDA trainer for EMS since 2019. Uh, First of all, because I was in love with EMS for the quality of the units of the material, and after also for the GBT protocol. I'm also founder of Natuf. Natuf is a brand of dental products, sustainable dental products. So I think maybe it's because I'm from Genova. Genova is a little city on the Mediterranean Sea in the north of Italy. So I love the sea, I love nature. And so I think for me it's very important to be to pay attention also to all the pollution that we can create every day, all the plastic waste that we create. So I have some notes here to not forget to tell you. And you can write me if you are more dental hygienist or dentist, and also if you use GBT protocol or not, because at the end of this live, I can read your question and answer also to you. So we can talk a little bit about our oral microbiome, okay? Because oral microbiome is the most important things in dentistry today. So what we have to do every day is to manage the biofilm, okay? So this biofilm is very important. Why? Because we can have eubiosis or dysbiosis. So if we have this microbiome in balance, everything is fine. But if we start to have some problems, we can have dysbiosis, and after we know that we can have chronic inflammation, and this chronic inflammation is linked to a lot of systemic condition. So systemic condition like cardiovascular disease, like pregnancy, like diabetes, so a lot. And we know that have periodontal health is also to have general health. Okay. So I think that every day in our dental practice we have to manage all these signs of inflammation, and the best way today to do the preventive dentistry is to have a protocol, and the best protocol that we have today is the GBT protocol, so the guided biofilm therapy. Okay. What do we know about the GBT protocol? We have a lot of clinical evidence. We have a lot of studies. Okay, so it's not just something that we decided to do, but we have science-based. Everything is very checked and controlled from researchers everywhere in the world. And about the protocol, if you don't know the protocol, we have 8 steps to follow. First is to assess. So we have to use the probe, we have to check our gum, we have to check all the soft tissue. After, we have to do something that it's very important for this protocol. So disclosing the biofilm. Disclosing the biofilm, it means show to patients what they have in their mouth, how they have to brush their teeth, why they have to brush their teeth, how they can clean between their teeth. So this is the moment where we have the time to talk a lot about everything, about the bacteria, about the systemic condition. So it's the key of the protocol. So once we start to explain how to clean the teeth, we can start to remove also the biofilm with the air flow. Air flowing is with plus powder, so it's an erythritol powder. It's very, very gently, and we can use it supragingival, but also subgingival. So we can go up to 4 millimeters. And if we need to go deeper, we can use the PerioFlow. After the PerioFlow, we have to remove calculus, and we have the piezo to remove calculus, up to 10 millimeters. At the end, we can check the hard tissue, so we can see better all the teeth, and after we can book the reminder, the recall, so the next appointment for the next time. So it's the best way to treat prophylaxis, to offer prophylaxis, and also to treat periodontal disease. About sustainability, because this was the topic, so GBT machine and sustainability. You have to know that here in Switzerland, last week we had a plastic global treaty. It was at the United Nations, and there was like more than 2,600 participants from over 180 countries. And they tried to have a consensus about plastic pollution. Okay, and it was the final session. And now this treaty failed, so we don't have any consensus. Okay, this means that there are some countries that have more interest in plastic production. And about this, we have to think that sometimes we don't have to wait someone who has to told us what to do. And what I love for in EMS here is that they don't wait to do a challenge, they do the challenge. So also before the GBT machine, they decided to switch from the plastic bottle for plus powder to an aluminum bottle. So this was the first approach, very important for me. And now with the new GBT machine, they reduce 30% less plastic for these units. So now we have tempered glass here, and we have also aluminum here. Okay, and this normally will also will be easier to clean the machine, and will be also long last this machine. And I think it's something very, very, very good for us, because you can think that in all the world, every year we have like 20 million tons of plastic waste in our ocean. So it is a lot. And in medical field, we have a lot of plastic. In dentistry, we have a lot of plastic. If you think about all the plastic waste that we do every day in a dental practice, like also dental products, there is a lot of plastic pollution. And the problem of plastic pollution is not just the pollution for the planet, but it's also for us, because you know that now you can find also microplastic in our blood. So we have to pay attention to this. And what about the new GBT machine? So, I use this new GBT machine since a couple of months now. So for sure, I had the airflow prophylaxis master. And what is the difference between the old one and the new one? So the new one is designed to GBT protocol. This means that you don't have to think a lot about settings, for example, because before you had the possibility to select more water, like 0 to 10, and also here you had the possibility to select from 0 to 10 for the power. Now, no, because EMS analyzed a lot of data, and they found that we don't need a lot of options. So now we have GBT settings normal at the center of the machine, but you can also put lower or higher if you need. When you start to use the GBT machine, the first things that you have to do is to disclose the biofilm. After, you have to rinse. And if you take just the airflow, you will have water, okay, to remove all the disclosing pellets. after, you will pressurize the chamber and you can start the treatment. So you can start to remove all the biofilm. After this, you will use the piezo. The piezo now has a new model. A no pain model is better than before. Why? Because he has an adaptation if we find hard calculus or not. So you will feel the power on the surface and you can adapt. So it's very easy for us as clinician, but it's also better for the patients because you cannot push too much on the surface because the machine will say, no, it's too much. But if the machine will find more hard calculus, yes, you will have more pressure. So it's very something can adapt a lot while the clean. And you also have the boost with the pedal. Also, the pedal is different because if you see, there is a lot of attention to design also. So this is matte. The old one was like brilliant. Now it's the same on the machine. So it's something very, very nice also for the design. And I think that it's very, very easy also for the connection because this new machine can be connected with the Wi-Fi or the dental practice. And this can help you to improve and analyze if your dental hygienist, for example, use more airflow or more the piezo, and how to adapt and how to improve the treatment. Okay. It's because sometimes people have the machine, but they don't do a really GBT protocol. So we can improve every day, I think. So I think it's okay. It's enough. I think I told you everything I wanted. Now, if you have any question, feel free to ask me everything. And I'm here to answer to you. And or you can also write me on LinkedIn or Instagram, wherever you want. And I'm here for you. Thank you.
Okay.
So there was one comment from Dr. Fontanetto who said amazing. So
Yeah.
no real questions, but he looks also interested
Okay.
in the machine.
Yeah.
And
Dottor Fontura?
no, Fontanetto.
Fontanetto,
Yeah.
ok. Ma posso rispondere? No.
Uh,
No, perché è
It's
finito.
okay.
No, sono live. Okay, okay, sorry.
Still live.
Okay, so Dottor Fontanetto, it's I don't know if you have the airflow prophylaxis master and you want maybe to switch, but I can promise you that for dental hygienists, work with this machine is something very, very, it's awesome. And for the patients also, because I work with this protocol since a while. And all the patients that I have, also if I change the practice, they come with me, they change the practice also like 20 kilometers. And it's something very different about the old cleaning. So with this new one GBT machine, the EMS improved a lot the quality and the comfort for the clinician and also for the patients.
There was only also one comment from Silvia from Brazil.
Yeah.
Saying
Hi,
that
Silvia.
she really likes the machine as well.
Okay.
So,
yeah.
Yeah.
Yes, I think that everyone who takes the time to test to this machine can feel the difference, because the first time that I used this machine directly, I felt directly the difference. And I'm also an experiment dental hygienist, so I have a little bit of experience. And I think also for me, it's very important to have a challenge, because always work at the same time, same technique, it's not okay. We have to change, we have to improve, we have to study a lot. Be an SDA trainer, it means also to study a lot, because every year we have a lot of things to do, a lot of things to study. Thanks to AMS, we have a platform where we can do a lot of things. So we have to change. We have to change always, always. And EMS do this in a very, very wonderful way, I think.
Thank you.
Yeah.
Let's see if there are other questions. Maybe let's wait 1 more minute.
Okay.
And yeah.
Okay. Okay. And meanwhile, you can see the GBT machine. Yeah. In a rainy day here in Lyon.
Another comment, I love GBT.
Yeah, sure. We all love GBT. I always say that this is the Ferrari, like an Italian girl, sure, of prophylaxis. I love it.
True. We have a question.
Yeah.
Do you have GBT training? So I think they want to know more about SDA, maybe.
The SDA. So I am an SDA trainer. So this means that I offer training here in the headquarters or also in dental practice. So yes, you can ask for your GBT expert in your area and ask for a demo, and you will have a training on the GBT machine without problems. So yes. About me, I'm a trainer because I love EMS. So the first time I sent my CV, my curriculum, to try to work with them, because it's a wonderful company, I think. It's the best quality since when I was in Italy in university. EMS was like the best, and so now I am a trainer for them. So it's nice for me.
Okay.
Very nice question.
Yeah.
Mm-hmm.
We're checking also other platforms.
Yeah.
Don't see more comments. So let's give 10 seconds to our followers. Maybe. There's a
Ah.
Yeah.
See.
So what is the biggest difference between the last machine and the new machine?
Okay. So I think settings, because it's easy for you now you don't have to think to change the settings. So now when you use the airflow, for example, you have standard settings, okay, and you can start to work easily. Okay, this is the first big difference. The second difference is the Piezon. So here you have a different non-pain module. So it's better than the last one. In the old one, we had the no-pain module, yes, but now they improved a lot. So this means that before you had this feeling that you had more power when you need, okay, but not 100%. So now when you use the new one, the new model, you feel on the surface that you have more power. You feel the difference. So this model is improved, and you have less plastic. So it's very the best way to have a new GBT machine in your dental practice, I think.
Thank you.
You're welcome.
So
I'll see other questions. So
I'm here.
you can ask your question to Cristina live, like
Yes.
by writing in the comments.
She can.
They are thanking you for giving the answer of the difference between the GBT machine and the airflow prophylaxis master.
So, what is the efficiency of the handpieces?
In terms of life, uh, I think we cannot say how long is the life of the handpieces because it depends also how do you use and also how do you treat every patient because you have to think that maybe for a normal GBT treatment, for example, you can take 30 minutes. Okay, in 30 minutes maybe you can use for 15 minutes the airflow and for I don't know 15 minutes also the piezo. Maybe for some other patients you use more the airflow or less. It depends. So there is not a really answer to your question. It depends how do you use the handpieces, but they are very good quality, so you don't have to worry about that.
Good.
Let's see if there are more questions.
No.
But for now,
It's nice to have you from every country in the world.
you can write anything on the chat, even where you come from. There's another question. It's
Yeah.
quite similar to the one
Yeah.
you just mentioned. So, how is different from the old machine?
Yeah,
I think you already answered that question.
yes, I give you all the answer. So I think it's the real difference. It's easy, an easy flow. You know, you have an improved flow, workflow, better than before. So also with the connectivity, if you have the perioflow, for example, okay, the machine will know that you are using a different handpieces. So you know that for perioflow, for example, you have to use different settings, and with the new one, the new GBT machine, when you put the perioflow, it's automatically, so you don't have to think about it. Just you take your handpieces, and it's fine. You can start to work. So it's faster also if you want. But you can reduce always. You can improve as you want. But normally, every time that you put here the handpieces, the settings are on the center. So it's the standard one.
We have someone from
Yeah.
Slovenia
Wow! Hello! Hello!
saying we don't have a certified GBT hygienist. So
Ah.
maybe it's something.
Yes.
Okay.
Yeah.
Okay, so you had to have a training maybe in your dental practice. So you can do the training for your dental hygienist. I think you just need this, and you can ask for your GBT expert for sure. It's always better to have the machine and a training, because if you only buy the machine, it's not very easy to use it without all the knowledge that there are behind the machine. So you have to use it in the better way, the best way. I think this is important. So have a training. You have to have to do a training.
Great.
Yeah.
Another question that we have already mentioned. Is there any improvements on the P-zone?
Yes. The no pain model. We talk about this. So the no pain model, it's better than the last one. So now it detects better the hard calculus. So the power is more than before. So it's something dynamic regulation. Okay. So this means that when you find hard calculus on the surface, the piezo so all the system paint module will fill the hard calculus and will improve the power. Okay, so you don't have to push too much, okay, or to think a lot about it, but the machine will feel and will improve the pressure. So this is a big difference also with airflow prophylaxis master.
Good.
Let's wait.
Let's wait a few seconds. If any question comes up.
Don't be shy. We are here to answer your questions.
Yeah. And we will I can speak. That's good. Fine. Okay. So thank you to be here. It was a pleasure. Feel free to ask also after this live and contact EMS or your GBT expert. And see you. Thank you a lot. Another one. Yeah.
This is
Sorry. Go.
last minute question.
Yeah.
Any course in Spain soon for people who is using the machine a long time?
I think so. Yes. In Spain, we have a lot of SDA trainer, GBT expert. Yes, for sure. We
also have a training center in Madrid.
Yeah.
So
a new one, last
Yeah.
year maybe. Yeah.
Mhm.
Yes, you can have a training in Spain.
So it's better to get in touch with the local GBT experts.
Yeah.
Yeah. To
Yes,
get
you can. Maybe they can find also with on our
or on the website.
On the website.
Yes.
On the SDA
On
website.
the website. Okay. Good. Thank you a lot. Enjoy GBT protocol and GBT machine. Okay. Bye.